So hello everybody. I have finally had a chance to put up a video and I'm going to talk to you today about working with resistant clients. I hope you're all right. I'm Sally Ann Armitage, but you probably already know that. I'm going to get on with it now. So let's do this. So quickly, the aims and objectives are to consider what is meant by resistant client, explore our own responses to resistant clients, consider the role of the core conditions, immediacy, reassurance and clarification, familiarise ourselves with the relational duel and drama triangle, and revisit the importance of continual self-reflection and development. So that's the plan for today. So before we begin, if you're able, I invite you to take a bit of time to sit with the topics in this lecture. You will be given the opportunities for self-reflection and you will be given opportunities to reflect on your client work. I know you might just be listening to this when you like cooking or whatever, and it might not be possible, but if it is, I think you'll get more out of it if you're able to take some time to sit with it a little bit. And I invite you to reach out to others if you would like to discuss this topic further. Your supervisor, your therapist, your tutor at college or uni, your colleagues, confidentiality permitting, or even me if you like. Yeah, that's fine as well. But finally, I think it's really important to note that I speak from my own frame of reference. I have my own character, my own values, my own way of working, my own personality, and I've been on my own journey. So what informs what works for me is based on all of that. And some of it might not feel right for you, and that's okay. That's all right. Just pick the bits that you find useful. Hopefully that's the point of all learnings. We pick what we find useful and we sit with that causes us to ponder, and that's what learning is all about. So resistance, and I put this in single quotes because I really want to, what's the right word? I want to challenge what we might think about resistant clients from the very outset. I think on social media, perhaps I sometimes hear people talking. The client came and didn't speak. The client came and just said a few things and it didn't flow. Maybe even the client seemed a little bit hostile and close to me. And the language of like, well, the client probably wasn't ready. It probably was nothing to do with you. You've done nothing wrong. The client wasn't ready for therapy. And yeah, okay, fair point, but I want to introduce a different perspective that resistance is a shared responsibility, shared therapist and client, and we can very, very much work with resistance. So I really want to challenge that idea that a resistant client is doing something wrong and they're being awkward or they're getting in the way of themselves, or been a pain for a therapist in any way. I really want to challenge that, and I'm going to read a caption out of this book to sort of really cement this, because this book, I could eat this book if I could eat a book and consume the knowledge, because this is Windy Dryden's key issues for counselling in action. It's a proper old version. I've got loads of these with the black band. I love them. Yeah, examples. I've got loads on my desk just now. I just love them. So this is the caption that I really need to talk to you about. This is page 37 in this version of my Windy Dryden book. So while most counsellors would agree that all clients should enter counselling voluntarily and free from all forms of coercion and threat, it is nevertheless common for counsellors to find themselves faced with clients who may need and desire help, but are involuntary, resistant to, or reticent about engaging in the process of counselling. Faced with these clients, counsellors can choose to accept the reluctance at face value, that is, as an unequivocal refusal to help, Alternatively, they can sensitively and non-judgmentally attempt to engage the client in order that the real meaning of the reluctance may become clear. It may well be that many reluctant clients need only to find genuineness, reassurance, and the right invitation from a counsellor to begin a relationship. And this is the important part. We play a big part in this and how it plays out, a transformational part in how it can play out with clients that have stuff going on and therapy feels incredibly difficult. So, what might you see if you have a resistant client? So you might see raised shoulders, straight back. You might see them scanning the room. Sometimes they look at my ornaments. They might feel quite formal in their speech and word choice. Avoid eye contact. Openly admit skepticism. My friend told me that this were good, but I'm not really feeling it. I don't know whether I need this. I can't really see how this could be helpful given what's happened for me, Aren't getting comfortable, so might be sitting on edge of their seat, maybe get the coat on, bag on knee, that sort of thing. Closed facial expression, so maybe quite a neutral facial expression, certainly not an emoting in their facial language. Closed or dominant body language, which is interesting. It can be both. Closed is, small and folded and unsure, and dominant is what is this about, like I'm not sure that this is right for me. Asking questions about your training and experience, unforthcoming with detail about their issues, and asks for assurances about the work and explains they're not sure they need therapy anymore. So those are just some examples that I've seen over the years myself. I've been a counsellor for over a decade now, and I have seen these play out in my sort of my career so far, and I probably will again. And being able to read and spot these can really inform how you arrive with a client when you can see straight away that they're maybe not 100% sure about being in this space, So why are clients resistant? Well, you name it. These are some examples. Worried about opening up about difficult experiences and emotions. Who wouldn't be? Who wouldn't be? It's hard, isn't it? It's hard. Life continues, and if you have a proper cry or get angry and ragey or dig something up from the past that you kind of thought you'd put to back of your mind, you still have to go back to life. So it's a big ask to do this. It's a big ask. The client might not want to feel reliant on anyone else, including the therapist. I've always done this myself. I've always been independent. No matter what's happened, I've always got through it myself. And I do not feel I can invite somebody into that position. Somebody who is external to me, who is an unknown. Trying to keep safe unconsciously or consciously. And I think that kind of epitomises what I'm going to talk to you about today. Difficulty trusting people in general. I've been hurt many times. Not sure what your agenda is. You're only here because you've been paid to be here. That suspicion. You don't really care about me. Doubtful things can change or that they're ready for them to. And the therapist isn't able to meet the client. And paradoxically, if I have a supervisee that struggles to be with a client, struggles to empathise, seems to have clients that struggle to be comfortable with them, one of my suggestions is always go back to therapy yourself. Find out what it is that's meaning or informing that you arrive with a little bit of a closed heart. Yeah? If you do, it doesn't apply to everyone, but often going back into therapy is the way to improve how we are as therapists ourselves. So let's talk more about this, yeah? What is this, a screen? Oh, yeah. So everything is about safety. I alluded to it a moment ago. All of this, all of the stuff we've just talked about with those squares on page are all about safety. A client feeling safe, psychologically safe, emotionally safe, even physically safe. When we think about those somatic responses, safety is everything when it comes to resistance in clients. We all want to feel well. We do. It might feel sometimes that somebody doesn't, or maybe sometimes feels that you don't. But deep down, underneath all the stuff, we all want to do well and feel well and live a good life. Think about the organismic valuing process, the actualizing tendency in person-centered theory. We all have a pull towards betterment and our potential, I suppose, being who we were born to be in all its individual magic, yeah? But along the way, our relationships might be a bit complex, a bit nuanced, or abusive. Circumstances, loss, grief, and trauma come along, and we decide the best thing to do, unconsciously or consciously, often unconsciously, is to adopt ways of living to help us feel safe. And they don't always seem to make sense at first. Yeah, which is why therapy is so powerful, to discover what it is that I'm trying to keep safe from and how am I doing it. What does safety mean to me? So how do we proceed with clients that feel resistant? When resistance seems to be causing a barrier or feel unsafe. So first off, the core conditions, always the core conditions: unconditional positive regard, empathy, and congruence. Research those words, embody that. Read there's a version of this. It's a bluish colour. I don't have it here, but it's this nature book, with black band and white in the middle, and it's person-centered counselling in action, and it's just like this. Have a look on, sort of auction sites, and see if you can find a copy, because it'll only be a few quid because they're proper old, and it's like the best thing ever, person-centered counselling in action. It's the best book for refreshing and regrounding a person-centered therapist, and indeed any therapist. Immediacy, reassurance, and clarification. So we're going to talk about these things as we go through now. So, core conditions. So when we're thinking about trying to support a client to feel safer, it's important to remember that the best way to create safety is through being a consistent, patient, and empathic person. That is the best way. If we overwork or try to be a little bit nosy with somebody, it can make them close to us even more. If we show impatience, it can make them close to us even more. Open heart, wholehearted presence. I am with you, and I will accept you no matter what. No matter what. You can sit there in silence if you want, and it's still all right. I am ready, and I accept you no matter what. So a person who is willing to be present and to be available for the client without putting pressure on them to become something other than they feel safe being at this point in time. They are where they are at this point in time, and no amount of fantastic pearls of wisdom or insights or maybe self-disclosure will help some clients. Yeah, there's nothing you can really say. Yeah. Others there is, and we're going to talk about that too. But some, just being there and being patient is what's needed. So, immediacy. Be present and be human. I always think I'm Sally first and therapist second, yeah? Which is true. This is me. If you met me in a pub or a cafe, this is still me. I'm on here in this bubble. But this is just me. I'm here with my clients. This is also just me. It's the same me. I'm not gonna change who I am to sort of try to fulfill any need of the moment. People will feel that. They'll feel that I'm putting this, oh, hi, yes, I'm the therapist. Nice to meet you. Come and sit. I know no one ever says that, but do you see what I'm saying? People feel it. The best way to inspire authenticity in others is to be authentic ourselves, isn't it? Hypocritical even, isn't it? To say, I'm going to be formal and aloof and hide behind my training and skill, and you be really authentic and flawed. Is that okay? So yes, if you want a client to be whole and authentic and as transparent as possible, then be that yourself. So what would you like to say to the client? What can you congruently say about the here and now moment? Immediacy. Examples. I wonder how you're feeling in this moment. I'm certainly feeling a little nervous. I know I want to help you feel comfortable here and able to speak with me. And I can feel myself kind of trying to decide what to say. It can feel strange to begin with. Here I am, a total stranger, asking you to speak about things that are quite personal. It's weird. It's weird, isn't it? Yeah, so look into the eyes of the person, look at the body language, look at how they've arrived and walked in, and feel how they are doing. Feel how they are doing. And tentatively and warmly open your heart to the here and now moment. Witness what you might be witnessing. Name it. Yeah, and some of you'll be like, oh, I'd never say it like that. It's all right. I said at start, didn't I? This is how I work. This is how I work. And it works for me, but everyone is different. Reassurance. Oh, reassurance. We're not supposed to reassure. Yeah, you're right. But in this context, I'll talk to you about how to navigate that. So what might be less helpful in terms of reassurance? So we can't reassure a client that therapy will work because it might not. It might not. So we can't start spouting like, oh yeah, loads of people get better. You will too. Yay! It's just you don't go there. It's not. Yeah. Most people I work with get well. You know. Oh no. Explaining that you will use your experience and your skill to bring about positive change for the client. That's distancing language, in my opinion. I can see why people say it because they're sort of reassuring them in that way, like, I'm really good at this, you know, it's all right. But taking that power away from the client by saying I'm the one with, you know, I'm the one that's going to make this all possible is just not useful, in my opinion. And using language that has implications for the power dynamic. I'm here to make this easier for you. I will be here to make sure this doesn't become too hard. I will be here for you, and we'll make sure that this isn't too difficult. Okay, this don't get too tricky. All right, you know, sort of a da 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 da. Because straight away it can make a client shrink in size, metaphorically or even physically. Shrink in size. Okay. Oh yeah, thank you. Oh, please help me. So yeah, I don't find that useful. So what can help in terms of reassurance? An explanation about what will be asked of the client during the session. So we've gone through contracting, we've had our initial assessment, and the space really is yours. I don't want it to feel too awkward for you. Of course not. But it might do at first, and I am here, and I am ready. And yeah, I hope this becomes a space where you feel comfortable. But you don't have to talk at all if you don't want. That the client sets the pace and doesn't have to continue. So there's no obligation to carry on after today. If you don't want to come back, you don't have to. That's all right. Offering them a chance to ask any questions about you or the process, pretty much what it says, and reassurance that you aren't going to interrogate them or analyse everything they say, that you just want to understand their world. So it's not, I think sometimes clients have this idea that we're sort of going to be doing this interpretation, this analysis. And I know some modalities it is more in that direction, but certainly for me, that's not how I work. So they think that everything they say and everything they come out with is going to be like, oh, I see, that suggests an attachment, And in your head, you might be thinking some of that, but it's not some sort of interview where you're going to make some conclusions about them, And I think that can be quite nerve-wracking for some clients, thinking, oh my goodness, are they interpreting everything I say? I don't even open my mouth in case they are. Clarification. So explain how therapy seems to work, perhaps using metaphors. So sometimes I say that if you think about your life experiences, there's no time really sometimes to have sort of to find an emotionally healthy way to navigate them. There's no time, or there's not the ability for when we're young. So we just throw our experiences into our brains. Yep. Onward. Yep. And we end up with a brain that's full of tipped out boxes and mess all over the floor and empty shells because nothing's stored away properly. And in therapy, we can start looking through all of those experiences, seeing them for what they are, maybe releasing some of that emotion that was felt, and start putting them back in boxes and labelling them and neatening it all up a little bit in there. Or you can talk about a table where we're going to throw everything out on the table, see what there is, sort through it. You might feel like there's a fog in your brain, that everything's messy, there's nothing to hold on to, there's no shape, or there's nothing clear at all, it's just a fog. So we're going to hopefully work through that and figure out what is in the fog. And also the ball of wool, people use that, the ball of wool is all messy and all unravelled and all knotted, and together we're going to get the threads and we'll say, okay, let's just make this into a nice ball again. That tangled feeling, that mess that can come when life experiences and emotions become too much. Ask them if they have experience of counselling or any preconceptions about what happens, and work with it. So if they've had counselling before and they found it pants, that could do to be something we find out about in it, because if they found it pants, then we need to make sure we're not going to do the same again, Preconceptions about what happens. I'm hoping that you're going to tell me what I need to do and give me some homework. And I'm like, well, that's not how I'm going to work. So let me tell you how I work, and be very clear about how you offer therapy, very clear. Give them a chance to ask questions, encourage them to ask any questions they like, and no question is a silly question. So they can ask anything they want, really. And people do ask me some really interesting questions about what it's like being a therapist. I've been asked that before. How they can be an easy client, has people been difficult clients, loads of different questions all over, and you can choose whether you're comfortable to answer them or not. I answer most, to be honest. I've never really had an experience where I've not felt able to answer a question, even if it's just in a brief way. Now, relational duel. Okay. This happens so much in our society, in our world. A relational duel. Yeah, you said that. But you said that. Yeah, but do you remember when you said that? Yeah, but I feel like this. Yeah, but I feel like this. So what about that? And before you know it, we've got people that are moving further and further apart, and understanding is becoming less and less of possible. So try not to be invited into this dynamic, because it isn't helpful. We are therapists. Or we are helpers. Some people might be helpers who are watching this. Be aware of what happens for you when you feel challenged on any level by your work with a client. I'll give you some examples of how this can play out. So the counsellor feels defensive in response to resistance. So client, I'm not sure how talking can possibly help, to be honest. Counsellor, it can help. It helps many people. Client, well, I can't imagine it helping me. What can talking do to help with everything that's happened? Counsellor, I have been counselling a long time. It's really effective, but it does need you to talk about your issues. Client, I don't really want to talk at this point in time. Counsellor, perhaps now isn't the right time. You could give it some thought and come back when you feel more ready. So what's happened here? The counsellor's been defensive. It can help. It helps many people. Oh, sort of trying to keep safe, the therapist there. Yeah, I've been counselling a long time. It's really effective, but it does need to you need to talk about your issues. Persecutory. Yeah, it will work, but you point. Not literally, but metaphorically. Yeah, it's not helpful. A client has come to us for help. They're not firing on all cylinders a lot of time because they've come to therapy. So be aware of what you're doing and where you've been invited to go. Yeah. The client is inviting the counsellor into a position of inadequacy, and the counsellor is saying, actually, no, it's really good. It's really good. Yeah. How can we do this differently? Let's have a look. So the counsellor responds rather than reacts. Client, I'm not sure how talking can possibly help. Counsellor, I know. It can seem quite hard to imagine, can't it? Client, definitely. I'm not sure what I have to do. Counsellor, well, I'd love to know more about you and what brings you to being here. Client, okay, well, can you see? Unite yourself with your client. Don't run off. Again, metaphorically, sorry. Don't distance. Be with them. They're all right to feel this way. It's safe to feel this way. You can think that therapy is a load of crap. It's all right to think that. It's not an attack on me personally. It's where the client is at, and that's okay. And if they did attack me personally, right, let's do this. I mean, physically, that's a different issue. But talking like verbal, like attack, like what? How can therapy possibly work? I don't understand what your job is about. I don't understand why. I don't understand why this is helpful to anyone. That sort of attack. Okay, yeah, I know. Yeah, it's true. I sometimes think that too. Like, yeah, people come to me and talk and start feeling better. Yeah, it is weird. Just be with it. Be with them. Cartman drama triangle. Did you see how that counsellor a moment ago was invited into persecutory and also defensive? Develop your awareness of how you respond to resistant clients, yeah? Victim, rescuer, persecutor. This is where we aim to be, right in the middle, not drifting towards any of them points, yeah? So victim, I mean, my work is really effective for loads of people. I do a lot. I've done a lot of work like this for years, and yeah, I think it is really good. I think it's really good. Victim, rescuer, come on, I'm here for you. We'll get through this together. You've done so well just arriving. Yeah, rescuer. And persecutor, well, you do have to speak about your issues. I can't help you if you're not able to talk to me about what's going on. Yeah, you've come here and that's not enough in itself. You need to actually talk. Can you see how, I know that maybe feels a bit extreme, but can you feel the flavour of those points there? Where do you go, eh? Be aware moment to moment of where you're invited to drift. Mine is always rescuer. That's where I'm inclined to drift. So that's my thing. That tends to be my thing. So where do you go? Try to be in the middle, not invited into any of those 3 points. And if you're always invited into them points, go to therapy, figure it out. Yeah, uncover it, get some, illuminate it. So things to consider. When a client seems resistant, it's for a very good reason. Remember that. Please remember that. These reasons may be in their awareness or they may not be. Honour their need to have defences to protect themselves. It can cause harm trying to bring about rapid removal of them defences anyway. Things that I hear as well about therapists asking clients direct questions about some of the stuff they've gone through. Don't do it. Don't do it. Don't do it. Direct questions about some of the difficult stuff they've gone through, the trauma even. Slow down. Be patient, be loving, and be present. They have chosen to attend counselling and they do want to feel better. And I know sometimes you think, well, they have chosen, but they've kind of felt under pressure. They're here though, yeah? I don't choose to see that as a barrier. I know it often is, but I choose to see beyond it a bit. So if someone comes to me and says, oh yeah, this person at work has sent me for this because they think I need it. All right then. Well, do you want to see what you can make of it? Because you might as well. Yeah, you might as well. I'm here. I want to see what we can do with the time anyway. Yeah, and that's that's a mentality I invite in you. Let's see what we can do then. It can be helpful to view client skepticism or resistance as much responsibility of the counsellors as the client. It's a shared responsibility. And it can be difficult, It can be difficult. It can be difficult because worst case scenario, you have clients come in, one session, don't come back, one session, don't come back, one session, don't come back. We have to be courageous, put on our big pants, our grown-up pants and say, am I playing a part in this? Am I playing a part in this? I need to sit with that possibility and have a think about how those sessions played out. And I know it's awful because you don't want to think, oh, it's to do with me. What am I doing? It's an awful feeling, isn't it? But it's part of being an ethical therapist to stop and think, what is my part in this? And the client is not responsible for your feelings. Okay, let's develop a bit of a thick skin and allow them to, yes, attack me if you need to verbally. And I just a caveat for that, because I know that's come up before in this talk. No one's allowed to verbally abuse me. Yeah. I hope that goes without saying. If someone is verbally attacking me, there is a point where I will say, I need you to stop and leave. Yeah. So just, I deserve to be treated well. But I'm also aware that sometimes anger and hostility is a part of the work, and I am comfortable with that. I can tell the difference between if it's emotion that needs to be worked through and it's to do with me, and somebody who's trying to hurt me, who's trying to hurt and upset me. So just to caveat that, you don't have to sit there and take things that you're not comfortable with. Yeah, I'm glad I mentioned that really. So if you feel the client's resistance, you may feel inclined to raise your own defences. Remember that drama triangle? These are often unhelpful. Be aware of how you respond, reflect on it, and explore it in supervision as necessary. Using supervision well is incredibly important. Supervision is not just a nice break away from the timetable, a chilled talk with somebody where it feels like just a nice chat, bit of cup of tea, yum, yum, yum. Supervision ought to be challenging, it ought to be nurturing, and it ought to be educational. Yeah, it ought to be all of those things ideally. Sometimes you get more of, some and less the other with certain supervisors, but insist that your supervision is the real deal. Yeah, time well spent, time where you are growing, time where you are challenged. So do you feel that you need to prove yourself as capable? Is that where you go? Do you doubt your abilities to face resistance? Do you feel anger, frustration, or impatience towards the client? Do you begin to doubt yourself in the face of resistance? Where do you go? Watch for it. When you're with clients, watch for it. So remember, we're on our final bit now for this talk. You bring the whole of you, even if you don't mean to or not. Phenomenology, you bring the whole of you. Culture, neurodivergence, work ethic, health, social identity, philosophical viewpoint, self-perception and trauma, and others. These are just some that came to my mind when I was doing this. It all comes with you. That's the human condition, yeah? And part of therapy is working out the interplay of these two souls that are meeting in this meaningful way, yeah? Be aware of what is happening in your mind and in your body when you're with somebody. They're talking about something. What shifts? What hurts? What goes on? Start to become aware of what's invited out from you. Reflect on it. Journal about it. Talk to your supervisor about it. Yeah? So overview, hopefully by now you feel more confident about identifying skeptical clients, have a better understanding of your own responses to skeptical clients or resistant clients. I don't know why I put skeptical on this. Had the opportunity to consider ways to support resistant clients and are more aware of the relational duel which can begin to take place. And have refreshed your awareness around the role of self-development and self-improvement when working with resistant clients. Obviously a bit tired when I wrote this slide, but it's all accurate except that word. So hopefully that feels like something you've done in this short talk. So really quickly, a bit about me. I don't like this bit, but I've got to do it because I'm a businesswoman, a fancy businesswoman. So I qualified as a person-centred counsellor in 2013. I worked as a counselling lecturer for 7 years, up to diploma level 4, and I currently teach a clinical supervision course. I have 8,000 plus. It's probably quite a bit more now of client experience, hours of client experience. I worked as a counsellor in the police force for 6 years. Really nice piece of work. The pot of funding was changed and the work ended, which was a shame, but I enjoyed that work. Qualified as a supervisor in 2020, and I got my master's in psychotherapy in 2022, a master's around working with trauma. So I hope you've enjoyed that. I really do. And if you want to get in touch with me, my email is sally@nextchapter.org.uk. Please like and subscribe and comment down below. Yeah, let's build my channel, my little channel. And thank you so much for joining me. Okay, bye-bye.